Well, from a physical point of view, if you just think about it, the colon is a tube.
Right.
And if it's full of feces and it's full of goo and muck and all that and toxic things there, the toxic things are going to diffuse into your bloodstream.
Right.
That's not going to make you feel good. The other thing is, if the colon is full and it's a tube and it's stretched, you are compromising the blood supply in the colon. Because it's a tube and it's full. It's got to have free blood supply. So your blood supply in your colon is restricted. Now your colon is a large organ in your body. The largest organ in your body is your skin. But your colon is also a large organ. Your colon is
22 feet
22 feet long. So when you squeeze that up, there's poor blood supply. So and it also plays a part in your immune system. Your colon has cells in it that produce antibodies, that attacks things that come to it, that recognizes poisonous things, recognizes germs, sends messages to the immune system. And if you have a poor blood supply in your colon, that is just one aspect that shows you can't function properly. So if you get all this goo out of your intestine, and you feed your intestine properly, you must feel better.
And obviously...
And you're going to lose weight.
Well, yes, definitely.
And if you lose weight, you've lost goo. You haven't lost weight from your body.
Right.
You lost fecal matter.
You lost fecal matter that has been there for many years.
So, I mean, in Trinidad, we are customer Jewel. You may have seen this since you're in Trinidad. You see, like, a lot of people, they have this, we call it pot belly. Yeah. Right, we call it pot belly. Some guys, and even some gals, they walk around with this thing in front of them,
That's right.
And that is basically what you're saying. It's goo that's encrusted in there.
Yes.
And
but the recent American papers in surgery and in medicine have done some simple things which they negated before. And they have recognized that fellows with a pot belly have a higher chance of diabetes, hypertension, cardiovascular disease, and sudden heart attack.
wow.
This has been recognized, and there's no big scientific thing about it.
That's right. The utter intoxication.
That's right. And then you have these toxins floating out into your bloodstream. Whereas if you take wheatgrass, you've got amino acids, you've got antioxidants floating out to protect you and improve your immune system and help you fight it off.
So, Jay, tell us exactly, back to that topic, and just as the doctor said, the immune system.
Yeah. The immune system is your major defense system for keeping the body healthy.
Right.
Any medical doctor, and plus myself, will both agree, we do not have an argument with this. Any disease in the body or any type of cancer is there because the immune system is not functioning right. That's the problem. The immune system is not working properly. So there is no drug you can take that's going to you can take, and then the immune system is going to be healthy again. What it is I put together this outline here, and I have 8 reasons why the immune system doesn't function properly. And number 1 is malnutrition, which is the tissue cells are not getting the proper nutrients to the tissue cells, and that's simply through the diet. And when you take a diet, which is just fat, protein, carbs, high calories, but no vitamins, no minerals, and for sure, no live enzymes, which are from the fresh living foods, okay? So malnutrition is a big one. That's number 1. Number 2 is the acidity in the body. There again, the alkaline balance, the pH balance is way off because of the high acidic type foods. Western diet, the rich Western diet is 80% acid foods, 20% alkaline foods. It needs to be reversed. That's obvious. And now the younger generation coming up, the next generation, they're on 90% acidic foods and 10% alkaline foods because they're hardly eating any salads, vegetables, or anything like that. So when they get to be our age, my age, which is middle-aged, okay, the serious degenerative diseases that these kids are going to have, it's going to be phenomenal. It's going to be a disaster.
Wow.
Number 3 here is dehydration. People aren't drinking enough water. The body's 75% water, not 75% soda pop, and not 75% beer. It's 75% water. Okay? Now, coffee and beer and alcohol like that are diuretics. They take more water out of the body than is put in.
Coffee.
Yes, it is. Caffeine is a diuretic. Yeah.
Wow.
So when you're dehydrated and you're not getting enough water, the tissue cells, they can't build themselves properly. They can't regenerate. The body, when dehydration is a very slow process. It takes years to really see the effects of it. When you're 50, 60, 70 years old, that's when you see your skin sag and your skin all wrinkled. Collagen levels are completely gone practically. And there's no water in the body hardly at all. It's dehydrated. So we talk a minimum of like 100 ounces a day for a typical person to be consuming 100 ounces of water a day. And that's in the intake of whether it's wheatgrass or whether it's in the food, in the juices that you're drinking, or whether it's in the vegetables. About 100 ounces is an average, which is good. Then number 3 is the autointoxication, which I talked about through the colon. That's number 4. Number 5 is the carcinogens, which is taken in from tobacco, street drugs, regular drugs, additives in the foods. Those are all carcinogens that the body has to deal with. And then oxygen deprivation, not getting enough oxygen to the cells. Major problem right there, because the cells need to breathe. They're all living little organisms. They breathe in air and exhale carbon dioxide. If you don't have that exchange happening, and the reason why this is not getting enough oxygen. So in order to get more oxygen, you got to rebuild the red blood cell, and that's where the hemoglobin is. It's attached to the red blood cell. That's the carrier of oxygen to get to the tissue cells. And how do you do that? Wheatgrass. This builds the red blood cell. If anyone's anemic, this is one of the best things you could ever do for people who are anemic, because this is going to get the red blood cell built up, which is the hemoglobin built up, carrier for oxygen, tissue cells then get oxygen, and plus the nutrients of this gets to the tissue cell. And then number 7 is exercise. People are not getting enough exercise. So that's important, because you're getting your breathing going, you're getting your blood flowing, and not to mention the lymphatic system is not being pumped. When you start exercising, the lymphatic system is a plumbing system in your body, which has the white blood cells are in the lymphatic system, in the lymphatic fluids. And it does not have a pumping system. It does not have a involuntary muscle system that's going to keep it moving. It moves through muscle contraction and movement. You need to keep that lymphatic system moving in order for it to filter out these problems, and the white blood cells can work on the carcinogens and the problems that are in the blood, in the lymphatic system. And the last one is stress, of course. Everyone knows stress is a major problem with all problems with the immune system. So these 8 line items are critical. And when I talk about these 8 line items, it's the first 6 right here that wheatgrass will really take care of really well.
Okay.
Dr. Mathura, from a medical standpoint, you can agree with those 8 reasons?
Well, from my little experience, I believe that his first 6, the first 6 things that he mentioned, especially the detoxification aspects, this works very well for it. I haven't really studied it with anemia, but it would, if these things are corrected, you would definitely improve your blood supply and your blood quality of your blood. It's not just the amount of blood you have, but the quality of blood you have. You could have a good blood count, but it's not carrying oxygen properly. And that is known. I mean, there are very rare diseases that we pick up in Trinidad here that exemplify that. The other thing is that my experience with it, my personal experience with my patients and myself, is that it has improved my quality of life. I breathe better, I sleep better, I have less stuffy nose, less headache, I eat less junk food, I don't feel like eating it, I have no crave for it, I want to eat more vegetables. This was the first thing that I found with this. And hence, at this stage, it has improved my quality of life. I have also given it to people who told me they have more energy and they don't know why they have more energy. Now, one particular patient that I have has lost 3 inches off her waist in 3 weeks. She has never been able to lose an inch for the last 20 years.